the strategies we have, like isolation and quarantine. So moving on to who should be tested. As I mentioned, we really want all individuals who are symptomatic to seek testing, and that includes people with fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches. New loss of taste or smell is a unique symptom that has been associated with COVID-19 infections. Sore throat, congestion or runny nose, nausea, vomiting or diarrhea. In addition to symptomatic individuals, we are now also asking asymptomatic contacts to cases to also seek testing. And those individuals should ideally be tested about 7 days after their exposure occurred. It's important for those individuals to talk to their healthcare provider, and we're providing this guidance to healthcare providers as well about the appropriate timing of testing. One really important message to go along with this is that just because a contact who doesn't have symptoms tests negative does not necessarily mean they are out of the woods. The quarantine period right now is 14 days, and even if individuals get tested at 7 days, they'll need to continue to quarantine for that full 14 days, because testing at 7 days or at any point in time is really just a view of that point in time. And it could quite possibly be that an individual who tests negative at day 7 could potentially test positive at day 8. And so again, there's really critical importance to ensure that individuals are quarantining for the entire 14 days after their exposure to a case. There's also a role for testing of asymptomatic individuals who are high-risk workers. It's important for those workers to follow their employer guidance. One example that comes to mind where this testing might be appropriate is individuals who are working in long-term care facilities, maybe a population that should consistently be tested to ensure that they're not transmitting infection to the residents of the facilities that they are working with. Next slide. Next is masks. So as the modeling data and Dr. Samet showed, masks can decrease transmission, hospitalizations, and ICU admissions. Next slide. So what we are asking is for individuals to wear masks or cloth face coverings when they are out in public. This is because masks or cloth face coverings can really slow the spread of the virus. They play a critically important role in preventing the spread of virus by those who do not have symptoms. And so this is really what we're asking people to do, is individuals who don't have symptoms, really anyone that is out in public should be wearing these masks. And to demonstrate what masks do, there's the figure on the right that really shows you that cloth face coverings or masks really present a barrier to the virus and respiratory droplets and really help contain those droplets so that they're not spread to individuals by the mask wearer. And so the important measures to be taken are that individuals really, in addition to social distancing, when they're out in public, should be using masks whenever possible. Next slide. But when we wear masks, it's important to recognize the importance of wearing masks correctly. There is the possibility of a mask wearer touching a contaminated mask potentially and spreading virus that way. And so it's important that individuals know how to appropriately wear masks. And critical to that is washing hands before and after putting on a face mask, not touching the face covering until you remove it. Masks should be positioned so that there's no need to adjust or otherwise touch the face frequently. So these masks should really be secured so that you don't need to adjust them or pull them down. If your mask becomes soiled or hard to breathe through, then it's time to remove it and launder it. And washing cloth face coverings in a laundry machine is a perfectly reasonable way to cleanse those masks. Removing masks to eat or drink is certainly appropriate. And if it's still in good repair, you can continue to use that mask to put it back on. Instructions for making masks can be found at the Colorado Mask Project website, coloradomaskproject.com, and there's also resources there on where you can purchase masks. Next slide. So next is the continued importance of social distancing at 65% to really prevent our healthcare system from being overwhelmed. And really, this was the take-home message that Dr. Samet shared with us from the modeling work that he presented. There is certainly a possibility for social distancing to be allowed to decrease to the level of 55%, but to do that really requires that older adults continue to socially distance at very high levels. And we really think it's probably much more practical to assume that lower levels may be occurring. And so we really want to be cautious and ensure that social distancing occurs at 65%. Next slide. And it's especially important for older adults to practice social distancing. As we know, those are really the individuals that are going to be at highest risk of severe outcomes due to COVID-19. And while we're asking older adults to continue practicing social distancing at very high levels, that doesn't mean that older adults in Colorado need to spend the summer indoors. We really want to encourage our older adults to get exercise, to be outdoors, but to do that in a safe way that allows them to enjoy the Colorado outdoors while practicing social distancing. Next slide. And so we know that age is a risk factor for severe illness due to COVID-19. Older adults and people with serious underlying medical conditions really are at the greatest risk of severe disease and death due to COVID-19. And that is what is shown in this figure. It shows you the number of cases, hospitalizations, and deaths due to COVID-19 that are associated with the infection. And so what you can see here is that those individuals that are 60 plus are really overrepresented when you look at hospitalizations and deaths occurring. So unfortunately, they are at greatest risk of both hospitalization and death. Next slide. Older Coloradans have the highest risk of COVID-19 hospitalization. Adults age 60 account for approximately half of hospitalizations that are occurring in Colorado to date, but only represent about 21% of Colorado's population. And the risk is even higher for those over age 70. Next slide. This shows you some data that comes from CDC's COVID-Net surveillance system that Colorado participates in. This is hospitalization data from the 5-county Denver metropolitan area, and it shows you rates of hospitalization by age group over time. And what this figure shows you is that really the highest risk of hospitalization is going to be among the oldest Coloradans. So if you look at those 85 plus, that's where we see the highest rates of hospitalization, and then really follows by age group down. So certainly the overwhelming burden of hospitalization is going to be among those over age 65. Next slide. Unfortunately, 9 out of 10 COVID deaths in Colorado have occurred in adults 60 years of age and older. Next slide. And that is shown in this figure here. So this is Colorado death data, and this is the data that comes from death certificates. So these are death certificates that are coded as COVID-19 being the cause of death. And what you can see here is that the overwhelming number of deaths that are occurring in the state are really occurring in those over the age of 65. Next slide. To maintain ongoing social distancing, older adults will continue to need support from family members, friends, community, and healthcare providers. And this is really one of the reasons that we sent a health alert message last night to healthcare providers around the state to ensure that they know the importance and are sharing this important message with their patients, that for those over the age of 65, it's critically important to continue social distancing at high levels. Next slide. So in summary, to protect older Coloradans and save lives, we really all need to do our part. 3 key actions for Coloradans to take right now are to get tested, whether you're symptomatic or you've had contact with someone and you're asymptomatic, to wear masks, to practice social distancing. And while I spent quite a bit of time talking about how older adults are at the highest risk of severe illness, we are also seeing severe illness occur in younger populations. So while 50% of the hospitalizations are occurring in those over the age of 60, that also means that 50% of hospitalizations are occurring among those less than 60. And in addition to that, we're also seeing new impacts of this virus that we're learning about every day, including the multi-system inflammatory syndrome in children, or MIS-C. Next slide. Thank you very much, and I will turn it back to Director Ryan.
All right. Thanks for joining us, and we do have a few minutes for questions, and I believe Mariah will facilitate that for us.
Yes, thank you, everyone. We do have some time for questions. So as I mentioned at the top of the call, if you would like to ask a question, please raise your hand. And to do that, click on the participants icon, and then you can choose the little raise hand button that will let me know that you would like to ask a question. And I'll let you know when you're on the line. And before you ask your question, if you could please say your name and the publication or outlet that you are with, that would be greatly appreciated. So first on the line, we have Aaron Prater. All right, Aaron, you're on the line.
Okay, hi, this is Erin Prater with the Gazette in Colorado Springs. My question is if there's a concern among state health officials that some of the recent protests that we've seen will lead to a second wave in cases.
Hi, this is Jill Ryan. I'll start off just saying that we do feel that it's important for people to be able to have their voices heard and be able to demonstrate peacefully. Of course, mass gatherings promote spread of the virus. So we want people to do it safely, to avoid crowding, stay 6 feet apart, wear a face covering. And this goes not only for people who are gathering, but also reporters and law enforcement. And that I will ask our doctors if they want to weigh in on your question just about the potential spread from these gatherings.
This is Rachel. I can add to that. So we certainly do know that when individuals are gathered in large numbers, there is the increased risk of transmission occurring. One of the numbers that the governor has quoted recently is that at any given time in Colorado, we estimate, given the current numbers we're seeing in the state, that about 1 in 300 Coloradans is actively infectious with this virus. And so certainly when large numbers gather, there is the potential for the virus to be transmitted. Just as Dr. Samet showed you through the modeling data, there will be a lag if there is potential transmission that occurs following these protest events or other gatherings of large size. And typically we estimate that it's about 2 weeks from the time of exposure until those cases are reported to public health. And so it will take about 2 weeks for us to know whether there is increased transmission that potentially is associated with large gatherings right now.
Next question will be from Kim Posey. Kim, you're on the line.
Okay, hi, I also have questions. I'm Kim Posey with Fox 31 about the protest this weekend. So how long until people should wait until they go get tested? Are you encouraging everyone to get tested? Obviously, we've all seen the video. Social distancing was not necessarily in place on a large scale. Some people wore masks, some people did not. What is the likelihood that we will see an uptick or a surge, and what do you suggest people who were there do?
Yeah, this is Rachel. I can take that question. So certainly anyone who has symptoms should seek testing. And typically the incubation period or the time of exposure until symptom onset is going to be on average about 5 days, but can be as short as 2 days and even up to almost 14 days. And so really it's any time during that time frame that individuals could potentially develop symptoms if they were exposed. As far as the timing for individuals who are asymptomatic, our recommendations right now are for individuals who believe they've been exposed to a case of COVID-19 to seek timing at approximately 7 days after that exposure occurred. And that really allows enough time for that individual to potentially test positive, but also is ideally trying to catch them early enough in their infection that they become aware of their infection and can stay home and prevent transmission to others.
This next question will be from Ray Ellen Bichelle. Ray, you're on the line.
Ray Ellen Bichelle, Mountain West News Bureau. You talked about the reproductive number and how it's changed. It's gone up a little bit, though it's still under 1. Can you speak in absolute terms exactly what it went from a couple weeks ago, or whatever your quote baseline would be to now?
Sure. So if you look at the report, in fact, and I've showed a plot of the R0 dropping from quite high levels initially down to below 1, I think towards the start of April, if I remember correctly. Actually, I can just pull up the picture, but the R0 will inevitably rise as we take measures to reduce the restrictions on behavior. So I think that, yeah, I'm just checking, it was before April 1 that it went below the value of 1, and it stayed in that range until now. And that's, of course, why we've seen the epidemic drop. We've had the good news, for example, of no deaths on several recent days. What in with most of us still susceptible, if we relax restrictions and begin to have more contact with each other, inevitably R naught will rise. And we'll be tracking that very, very carefully, because I think from the public health point of view, it just can't rise too much.
Great. This next question will be from Chris Vanderveen.
Hi, everyone. Thanks for doing this again. My question is a bit twofold, but I want to ask it in one part. First of all, I think people are having a really difficult time understanding the difference between 65% social distancing and 55% social distancing. Based upon your modeling, while it may not sound like a lot to the layperson, your modeling suggests that it could make a huge difference when it comes to ICU utilization. To that extent, also, in addition, what do you tell the governor, who just last week said he wasn't going to look too much into modeling, but your modeling couldn't be making your models seem pretty crystal clear that if we go much further than where we are now, that there's going to be a spike, and in your own wording, a spike larger than we saw in April. So there's a bit of a disconnect here that I'm trying to wrap my arms around, but help me out here, understand the difference between 65 and 55, and also the implications for state leaders as they try to decide how they reopen the state.
Right. So good questions and tough questions. And I think, first off, you've interpreted the scenarios quite correctly. There's quite a difference between 65% and 55% in terms of outcomes. This is not strictly linear. I think the complexities of relating all the things that we do, all the measures that might be taken at the state and local level, and turning those into these percents represent a challenge. And we are sort of retrospectively estimating these distancing figure based on what we actually see. We're working very hard to take what we know about behavior and how it's changed. And here we're using our understanding of mobility and these different resources that are coming from mobile phone movement to try and do a better job of pinning down. In a way, there's some complicated trade-offs. If we have a margin of, say, getting to some percentage, 65 or 55, that reduction distancing could be used up in a sense in different ways. And what we're trying to do is look at what happens with different changes in behavior and how that would affect where we end up with social distancing. So for now, we're tracking closely. There's clearly an interplay between the social distancing figure and what the R value is. And we're trying to develop a better inventory of behaviors that we change as people, or that can be changed in response to orders, and how those relate back to these percentages.
Yeah, this is Rachel. I can add a little bit to that too, and say that, as far as what we are asking the public to do, it's really to have, fewer than half as many interactions as they would normally. So thinking about this summer compared to last summer. And when you think about those interactions, it's both the frequency of interactions you're having with we're asking individuals to reduce, but also the size of those gatherings. And so we want individuals to get out and enjoy the summer and get outdoors, but to do it in a safe way and to do it in small groups. And perhaps when you're interacting with others, do it a bit less frequently than you may have otherwise in previous years.
Thank you. I just want to remind everyone, if you have a question, please use the raise hand function. So to click on participants and then the hand icon. so that I can see everyone that's looking to ask a question. So our next question will be from Taylor Summers.
Hi, Taylor Summers for NBC News Radio in Denver. I was wondering, kind of a follow-up here to Aaron's question earlier. Could you explain how contact tracers would help find possible cases in connection with these large gatherings and protests that we saw to help prevent future outbreaks? And if you could speak to if there would be any potential push to ramp up testing so there could be a way to prevent community spread from this.
Sure, this is Rachel. I can talk a little bit about contact tracing. So contact tracing really refers to exposure notification. So what typically our public health staff do is when we are notified of a case, a laboratory result for COVID-19, we work to contact that individual and try and identify individuals they may have been in contact with. And then the next step is really to try and notify those contacts of the potential exposure they would have had. And we really do that in a confidential way that ensures privacy of individuals. And the idea there is to notify those individuals so they can seek testing if needed, and certainly also quarantine themselves for the duration of the quarantine period, which is 14 days. You know, that obviously is challenging to do in an environment where you don't necessarily know who you've had contact with. And so certainly the environment of a protest or another large gathering makes that challenging. And so we recognize the limitations of some of those public health interventions in those settings, but really our primary focus is going to be on notifying individuals of exposures to those individuals that they've had close contact with. So typically we say, you know, within 6 feet for more than 15 minutes.
Okay, next question is from Meg Wingerter.
Hello, thanks for taking our questions. One thing I wondered, wanting people to stay within their county, stay close to home as much as possible, but also talked about, you know, wanting people to get outside and, you know, get the exercise and mental health benefits. And, you know, we're seeing some of the mountain communities are, you know, opening their restaurants, opening their hotels and things, which would seem, you know, invite people from the outside to come. So is it basically just kind of asking people to voluntarily limit where they go, or the extent of how they do that, or is there any way to kind of more encourage that people to stay close to where they are?
Yes, so you will notice in the executive order and in the public health order, we are encouraging people to stay within their counties for recreation. We're not mandating it. You know, it's this really difficult balance because we live in Colorado and we have all of these outdoor recreational amenities. It's part of our identity. It's healthy for people to get out and recreate. And yet we know that the more populations mix, the higher the likelihood that disease transmission will pick up and will pick up around the state. So, you know, Rachel talked about social distancing earlier and people reducing their social interactions. And so we are asking people to voluntarily, if they are going to go to another area to recreate, that they gas up in their own area before they leave. If they're camping, they buy groceries in their own area. And so we are reducing population mixing as much as possible, but we are asking people to voluntarily do it, to cut down on how much they are recreating in other areas, but we are not prohibiting it.
All right, and we are coming up here on the end of our time, so this will be our last question. And this last question, Sam Brash, you are on the line. Oh, sorry about that. I think just one moment. You're
okay,
on the line now, I think. Yes, we can hear you.
I guess I have two questions, if that's all right. The first, with regard to the mobility data, that's been called an early warning sign for this virus, before we see increasing hospitalizations. You talked a little bit about what's going on with that data, but I just want you to be really clear, is that early warning sign blaring? What does the mobility data tell us about the potential for increased infections? And I'd like just to go back to Chris's point from earlier too. You spoke about what this means for individual action, but if we're trying to keep social distancing levels as high as they need to be, what does that mean for policies? What do states and counties need to do, and are they doing the right thing currently?
Well, this is Johnson. I'll take on the first part around the mobility data. I mean, the mobility data are, in a sense, doing what we'd anticipate given the measures that have been taken. The mobility data don't capture everything, and they certainly don't tell us about mask wearing or how people are behaving, but we know people are moving more. What we're trying to do is to use the body of data that we have to bring some granularity to it that will help us understand, for example, movement of older people, that would say, are we seeing the kind of greater maintenance of social distancing by older people? We're looking at different venues and locations, and we're trying to do a better job of putting this into the model so we can, sort of make our projections more accurate. I mean, right now with this 2-week lag of looking back and saying what has happened in a sort of an overall, I'll use the word system, where as we make changes, things happen slowly. We need those early warnings. And I think if we can build them in more sharply, I think that would be useful for CDPHE and its messaging. So we're putting a lot of effort into that. But I think there are parts of this that perhaps should sit with CDPHE to answer as well your question.
Sure. Well, I'll take your policy question, and then if Dr. Herlihy wants to talk any more about our early warning system, that would be good too. So, the state in our executive order and public health order, we really set a ceiling for loosening restrictions, but we do have this variance process in place. And we say for counties, if your disease prevalence is lower than the state's, and even some cases, if it's higher, we will consider a variance. And what that requires is that the industries for which the counties are applying for these variances have worked with the local public health agencies and provided a thoughtful plan about how they reopen in this new normal and in a safer manner. And the variances have been very thoughtful. So these various industries are using things like reduced capacity, social distancing, keeping people 6 feet apart if they're within a building, if they can promote their business outside and extend outside, they are. People are wearing masks. They keep a line list of who's interacted with the business in case there is an outbreak, so the epidemiologist can contact those people. We've asked businesses, once they have once they've identified 2 cases of COVID-19, to close for 48 hours and go through the list on our website, including contacting the local public health agency to let them know, so that we can really keep outbreaks contained at the business level and not the societal level through some of these more restrictive orders. And so that's how, through policy, we're really trying to, again, continue to suppress the virus, but also promote economic stability with loosening these restrictions.
All right. Well, I think that brings us to the end of our time here today. So again, our participants, our speakers were Jill Hunsinger Ryan, Executive Director of the Colorado Department of Public Health and Environment, Dr. Rachel Herlihy, State Epidemiologist with the Colorado Department of Public Health and Environment, and Dr. Jonathan Samet, Dean of the Colorado School of Public Health. We thank you so much for joining us here this morning and hope you have a great afternoon. Thank you.
Thank you.